I'm seeing so many people with mid-thoracic back pain in the pain clinic where I work. I think it is because we are spending too much time in front of computers, smartphones and TVs and not doing enough physical activity. A lot of people, including teenagers, are coming to me now with pain in this area. I'm talking about a pain that is diffuse, uncomfortable. It's hard to find a position to alleviate it. The person feels some knots, the muscles are tense like tight ropes. There is a sense that something is out of place, and when they move the parts, they hear a lot of cracking. What is that? Today we'll talk about mid-thoracic back pain, and I'll show you my secret weapon that I use when I have this nagging pain on my back. So let's talk about mid-thoracic back pain today. The thoracic spine is composed of 12 vertebrae between the cervical and lumbar spine. Each one of these vertebrae supports 2 ribs, one on each side, to form the rib cage around the chest and protect important organs like the heart and the lungs. Because of the rib cage, the thoracic spine is not so flexible for flexion and extension, and when compared to the cervical and lumbar spine. The main movements of the thoracic spine are rotation and some lateral flexion. So, it is relatively rare to have disc herniations and spinal stenosis in the thoracic spine. Those are problems that we commonly see in the cervical and the lumbar spine because of all the flexibility in those areas. When the patient complains of pain in the thoracic area, it is very important to rule out some serious problems like fracture, infection, tumor, and cancer metastasis to the bones. That's why it is important to see your doctor before you diagnose yourself. Your doctor will ask questions related to fever, night pain, unexplained weight loss, previous diagnosis of cancer or osteoporosis, use of corticosteroids or IV drug, for example. All of these things increase the chances of a serious cause of pain in the thoracic spine. Also, the physician or your physical therapist will examine you and do some special tests, like tapping on the bones with a reflex hammer. And when there is, for example, an osteoporotic fracture, the patient will feel pain when we tap on that vertebra. Now, after we exclude any serious cause of pain in this area and we palpate the muscles and they hurt, this is a sign that there is some myofascial trigger points in this area. Check my other video about what is myofascial pain syndrome. It is basically pain in the muscles caused by tiny areas that are tight and not receiving enough oxygen. One of the main reasons for myofascial pain in this area is poor posture, or when our head is protruded forward like this, we call it hyperkyphosis. Hyperkyphosis has become very common, and these muscles are then being pulled and stretched all day. They get weaker and weaker, and then the trigger points will flare and hurt. So, what is the treatment for these trigger points? In my other video about myofascial pain, I explained that to eliminate trigger points, you need 4 types of exercise: SSAR, stretching, strengthening, aerobics, and relaxation exercises. For the mid-thoracic trigger points, I recommend you to also add some massage before you start the SSAR. So, we'll demonstrate the M SSAR. The M is for you to remember to self-massage before you exercise. I will show you some techniques that I use for my own trigger points. I have a couple in the rhomboid muscles. This is a picture of the rhomboid muscles. They connect the spine to the shoulder blades on each side. When we are sitting in front of a computer, we are pulling them apart and they become weak and painful. The other muscles commonly affected is the levator scapula. This muscle connects the upper part of the shoulder blade to the neck and is also pulled when we keep our head forward like this. The paraspinals are all of these deep muscles connecting and stabilizing each vertebra. They may also have trigger points. In this video, I'll demonstrate exercises with some simple equipment today. You don't need to have all of this equipment. I'm showing them so you get some idea of what can work for you. I recommend you to talk to a physiotherapist so they can individualize a routine that works for you. The exercises that I demonstrate in all of my videos are only for educational purposes. I believe that education is therapy. A person that is informed about all of their options and understands the reasons why they need to do movement will adhere more to an exercise routine. In this video, I will show you 25 exercises, but you don't need to do all of these 25 exercises to get better if you have trigger points in the rhomboid muscles. In fact, if you choose a few and do them well, you will notice a lot of benefit. Choose 5 exercises and do them many times during the day. Think of exercises as snacks. Instead of eating a big meal once a day, you may get the same nutrition if you eat 6 small snacks a day. So when you watch this video, take notes of 5 to 10 exercises that you like the best. Then plan some breaks during your day and take your exercises snacks. So for the exercises today, I'm going to demonstrate with some equipment. Again, you don't need to buy all of this equipment. It's just to give you some idea. Maybe if you buy one of these things, it's better than nothing, but you can also do this without this equipment. So you can have a tennis ball. We will need a tennis ball for massage. This is a shepherd's hook, also very helpful for self-massage. Then this is also for self-massage. This is a foam roller, very hard. This is my secret weapon. Also, we will need some free weights, and I use this. They have 3 pounds for our arms exercise. I also have an elastic tube, resistance tube. I will demonstrate some exercises with this tube, elastic tube. I also have this open elastic bands and some elastic bands that are looped. They are closed like this, and they come in different, some that are harder, and this is very hard. The black one is very hard. The green one is very light. So depending on how much strength you want to put on these resistance bands, you can buy different resistance for you. We'll also need a mat because we will do some exercises on the floor. And then I'll also demonstrate some exercises with an exercise ball. So again, you don't need to have all of this. But if you do want to invest on something like even a simple tennis ball, you can get a used tennis ball, and that would be excellent for you to do the self-massage. So with the tennis ball, what we're going to do is massage the area. So you find a tennis ball, put the tennis ball in the area that hurts most, and all you have to do is just roll it on the area that is hurting. You'll see that you find the point and then you just massage that area. If you do this for 30 seconds, 1 minute, you will feel a lot of relief. It's almost like a finger pushing and massaging that tender point. Try to find in the muscle, not in the bones. With this shepherd's hook, that you can find in some stores, big box stores. There are many different types, but what I like about it is that I find the trigger points in the muscles, especially in that rhomboid area, and then I massage here. I just found one. And if you just put your elbow in front of your body, you open the space and allow more room for you to find the muscle. And when you find it, you apply pressure going forward, and then you massage that muscle and do this for about 30 seconds. So the only thing is that you have to find a space in your house to store this one. I like the tennis ball better because the tennis ball is small, it does the same thing, but you can also keep in your office. You can, when you travel, if you have a lot of pain in that area, you can bring the tennis ball. Bringing this is a little bit more cumbersome, but this can have a lot of other utilities for other parts of your body. But today I am demonstrating for the mid-thoracic back area. So with the foam roller, what we're going to do is you have to lie down on the floor and you have to adjust. Start with the foam roller in the lower part of your chest, the thoracic spine here. When you find this position, what you're going to do is raise your pelvis, and this is the position that you're going to do. Keep your neck stable, and you're just going to roll until you don't need to go all the way to the neck or the lumbar spine. It's just the area of the thoracic spine where the ribs are, and go back and forth. You may hear some cracking when you're doing this. That's normal. It's just the vertebrae are adjusting. And if you put your arms up like this, you're opening the space between the shoulder blades, and then you're exposing the muscles even more. That's better if you do this with your arms up in the air like this. So next we need to start moving those muscles. And I usually recommend for aerobic exercises, I recommend that you go for a walk or for a run or for a bike ride or even dancing. I made another video that I talk about dancing as a type of aerobic exercises. So the first exercise that we'll do is about range of motion exercises. And what we need to do is move the thoracic spine to gain some range of motion. So let's start with that. The movements of the spine include flexion, extension, lateral bending, and rotation. So a lot of rotation happens in the cervical spine and the lumbar spine. And we also do rotation in the thoracic spine. But flexion and extension happens mostly the cervical and lumbar spine. So we're going to do for all three areas of the spine. So to start with the cervical spine, we're going to do flexion and extension, lateral bending, the other side, and now rotation. Now we're going to do the same thing with the thoracic and lumbar spine. So flexion, go as far as you can, then extension, look at the ceiling, lateral bending to the other side, and rotation. Bring your arms up and turn, 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 turn until you look at the wall behind you. You see I'm using the whole spine to rotate. So all of those vertebrae from the neck, thoracic, and lumbar spine, they're all rotating. So that's good to gain some range of motion of all spine. So after you warm up or after you did the range of motion exercises, we're going to start strengthening those muscles. And we need to strengthen the rhomboids, the levator scapula, infraspinatus, the paraspinals, the trapezius, all of those muscles. And to do this, we may use this tube, elastic tube. And one of the things that I like to do is the rows. So what you do is you step, this is a light one, and you can buy some that is harder, more resistance. So you step on them like this, because we're going to pull this way. If it's too light, the less tube you leave here, the harder it gets, right? So then you just turn, bend your trunk. Remember to keep your lumbar spine straight. So don't be bending too much your lumbar area. And from here, we are going to pull backwards, so like rowing. Roll, roll, roll. Okay, and then you can do this 8 repetitions. And depending on how tight is your elastic tube, you're going to do more strengthening. And when we do this, we're strengthening not just the rhomboids, but the infraspinators, the levator-scapular, some exercises. So you do this 8 times, and then you can increase to 12, 20, if you can repeat this. The other exercise that is also helpful for those muscles in the back, you step here. And now we're going to pull this forward in front of your body. And we're going to do this all the way up. If you have any shoulder problem, you can bring up to here. And you can also do this 8 times in front of your body. And so when you're doing this, you have to feel, keep your spine straight, keep your chin tucked in. Keep looking in front of you, don't keep looking down, just keep looking front. You do this in front of your body. And now you're going to do this on the side of your body. And for this one, it's enough just to bring to the level of your shoulders. You don't need to bring too high up. And again, repeat it 8 times, and then increase to 12 and 20 if you can do it. So you see, you can bring these elastic tubes with you to your office or when you're traveling. And this is such a great exercise to strengthen the muscles of your mid-thoracic area of your spine. So now the next exercises, we are using either these resistance bands that are open loop or the closed ones. The open loop ones, the open resistance bands, it's good if you have a good hand grip because you have to hold it. If you don't have a good hand grip, then buy one of those that are closed loop, because then you just use around your wrists. What we're going to do is, first exercise is just keep your hands around the level of your shoulders like this and just pull apart. Just doing this. So just pulling apart. And when you do this, try to find if you are moving the back muscles. So don't do this with your shoulders. So don't use your deltoids to do this. That's not what I want you to do. I want you to feel that you are moving the muscles in the back, in your thoracic spine, like pulling backwards. So then you can do this about 8 repetitions. And when you are good with this, you can increase the resistance of the band, or you can increase the number of repetitions that you do. That's called endurance exercise. Endurance means you're doing more repetitions of the same exercise without getting tired. It means that your muscles are now better prepared for more exercises. It's called endurance. So that's one. The other one is, it's still with the resistance bands. I want you to bring all the way up. And now you're going to bring your arms in front of your head. And do this 8 times. 2, 3, 4, 5, 6, 7, and 8. And when you bring in front of your head, you can also touch your chest here. And now you're going to do the same thing, but touching the back of your head. So you're going to do this 8 repetitions here to bring it behind. You see, so when I'm doing this, I'm forcing the muscles on my back, my rhomboids, all of my trapezius muscle, my latissimus dorsi, all those muscles, they are working because now I'm bringing this here in the back. And the other exercise that you can do with this band or with the other one, I'll show you with this one here, just so you see how it works, but you can do with either one. Now you're going to hold here on your back and you're going to pull it and move, touch your butt area and move away here. So you're going to do this, touch and move away. You can also do it for this side and this side. Always pulling, always putting some tension here in the band, okay? It's not just holding it, it's putting tension. And you can do this way, and you can also do this. Okay, excellent exercise for the back muscles in the thoracic spine. So now with an exercise ball, you can do so many exercises. It's so versatile. There are many things you can do with this for your whole body, basically. I'll show you 2 exercises that you can do with an exercise ball if you have one at home that is excellent for this area of the body. The first one is what's called the Russian twist. And so you sit on the ball. If you have poor balance, please be careful so you don't fall out of the ball. So you sit on the ball, and now you're going to start sliding on the ball until the ball is touching that area of your body, which is the thoracic spine, okay? Once you are there, you hold your hands in front of your body, keep your neck straight, and it's important that you hold your hands here, because now you're opening the space between the shoulder blades there, and they are all exposing those muscles. And what you're going to do is you go on one side and on the other side. So here I'm touching, my right shoulder blade is touching the ball. I come to the middle, and now my left shoulder blade is touching the ball. And you do this about 8 times for each side. It's important that you keep your pelvis at the same level of your knees, that you keep here like all straight, and your neck is also straight. This is an exercise that is difficult for some people. They don't have a lot of balance, so if you cannot do this, please don't do it. And when you finish, you just go back in the sitting position again, and then you are done. So the next exercise with the ball, the exercise ball, is if you have one of these and if you have hand weights, this is also excellent for you to do rolls. What you do is you lie down here on your stomach, make sure that you support on your chest, and then grab your free weights, and now you're going to do rolls this way. It's good for balance, and it's also good for strengthening those muscles in your back. So roll, roll, roll. Here. So this exercise is the corner push-up. You have to find a corner in your room, and then what you're going to do is put your arms around the same height of your shoulders. And if you come too close to the corner, then you'll just be doing some stretching for the pectoralis, which is not exactly what we need to do. So what we are going to do is push-ups on the corner wall. So you have to come backwards, maybe 2 feet or 3 feet backwards. And with your hands here, now you're going to do push-ups and put all your weight around towards the corner. And you see I am now contracting the back muscles of my thoracic spine. So when I do this very slow. You don't need to do this quick. And the important thing here is that you are contracting, and you're also stretching the pectoralis muscles in front of your chest, which is usually very good for people who have hyperkyphosis, that they are like this all the time. They need to stretch the pecs muscle. So this is a good exercise to stretch these muscles. And you can do this 8 repetitions and increase to 12 and 20. And that's the corner push-up. So this exercise is the wall angel. And what you need is a flat wall, no pictures on the wall. And you're going to stay maybe 1 foot apart from the wall, with your feet apart from each other. You're going to touch your pelvis, the shoulders, and the back of your head on the wall. Not like this, don't look down. Your chin tucked in and looking ahead. And now you touch your fingers on the wall here, and we are going to do the wall angels. So imagine that you are doing the wings of the angels here, and that's the wall angel exercise. That's good for range of motion of the shoulders, but also moving all of those muscles, the paraspinals, the trapezius, elevator scapula, all of the muscles on the back. And this is also good for people who have hyperkyphosis, because sometimes it's even hard when a person has the head too much protruded ahead of them. They can't even touch the wall with the back of their head. And so in this case, they can put a small towel on the back of their head and hold it here. So this is really good to even prevent people from developing hyperkyphosis and those rounding of the shoulders that happens when we are doing things too much here in front of us. We need to open up the space. So this is what the wall angel exercise does for us, because then it allows us to recover our posture. It's excellent for our posture. So the next exercise is the plank. The plank is an exercise that is excellent to maintain to strengthen all of the paraspinal muscles, the abdominal muscles, the glutes, that all of these muscles give stability to the spine, including the thoracic spine. So the way we do a plank, we need a mat, comfortable for your elbows. And it's important that the elbow is under the shoulder. And when you find this position, we are going to do raise like this and straight. Your body has to be straight. And you do this, you hold it for 10, 15 seconds. And if you can, you hold for 30 seconds. And the idea is that you will be able to hold it for 60 seconds or 1 minute. So the next exercise is the side plank, that is also excellent to strengthen the muscles around your shoulder and the thoracic back area. There are two ways that you can do the side plank. One is easier with your knees bent, and it's important that the elbow is exactly under the shoulder. So don't do this and here, but right under the shoulder. And so now that we are going to do the easy one first, where you raise on your knees and you hold this position for about 10, 15 seconds, 30, or even 60 seconds, 1 minute. And also do for the other side, repeat for the right and the left side. And the full side plank is when you hold all of your weight on your ankles. So you have to do, your body has to be straight. And again, the elbow under your shoulder. And let's go and hold up. And when you do this, count to 10, or you can count to 15, or 30 seconds, or even 1 minute. I rarely can get to 30 seconds. So it's a harder exercise, but the more you practice, the longer you can hold. So this exercise is the cow cat, and we are going to do a modified version. We are going to cross our hands in front of us, because we want to open and stretch more the rhomboids muscle. So first we're going to do the cow. So you lower your spine, your lumbar curve, your lumbar spine, and look up, all the way up. It's almost like if your navel is touching the ground, you want to touch the ground with your navel. Now we're going to do the opposite. Now you're going to go up. This is the cat. So we look down, 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 down. Our head goes down. And our trunk goes up. And we push down the floor, like if we wanted to push the floor down. And then we come up. And you do this 8 repetitions for each side. And that's the cow cat exercise. So the next exercise is the Superman. This exercise is excellent to strengthen the paraspinal muscles. And what you're going to do is, on a mat, you're going to raise your head and your legs at the same time. And you're going to hold on this position you can start with 10 seconds, increase to 15, 20, 30, and 60 seconds. So when you hold in this position, all of the muscles on the back of your spine, they are contracting, holding there, and you are strengthening all of those muscles. So now this exercise is stretching. We're going to start now stretching all the muscles on the back of our thoracic spine. And to stretch all the muscles down from the neck and thoracic and lumbar spine, I love doing this stretch on the chair. So you put your hands around the back of your neck, at the back of your head like this. And we're going to go down a chair. When you're sitting on a chair, we're just going, let the weight of your arms pull down, and you can open a little bit the legs here and just go down. You don't need to push too much. Just the weight of your arms is pulling down. And if you can touch, if the elbows can touch the knee, that's good here. And stay there. And come back slowly. Come back slowly so then you don't get dizzy. The other exercise is to stretch the levator scapula, which is more in the diagonal. You're going to hold here on the back of this chair, and you're going to pull in this direction here. So the elbow towards the knee, the right elbow, right knee. Come back slowly. And now hold on the other side, and the left elbow towards the left knee. And do this stretch. So the other stretching exercise is what I call the scarf, and this is excellent for the infraspinatus muscle. So you're going to bring your elbow in front of your body, and with the other hand you just pull here. You can turn your body if you want and hold it and feel all the muscles stretching there in the back, and do the same thing for the other side. So bring this arm all the way like a scarf, and the other one pull, and you can turn your body towards that side so you stretch a little bit more. Hold it. You can hold for 10 seconds and release, and you can repeat these exercises 3 times for each side. Now the other stretching exercise is for the rhomboids and infraspinatus as well. You just hold your hands in front of you at about the height of your shoulder, the same level of your shoulder here. So hold them here in front of you, and what you're going to do is you're going to pull forward, almost like if I want to come and touch the other wall here where you are, but without bending my trunk. So my trunk is stable here. It's almost like if I'm attached here to this chair, but I'm pulling now. I'm going to start pulling my hands in front of me if I want to touch that wall. And pull, 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 and relax. So pull, 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 pull in front of you, and relax. And you can do this 3 times. Pull, 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 and you can hold there for 10 seconds. And relax. So when you do this, you feel all of those muscles being stretched on behind where your thoracic spine is. So don't forget also, during those periods that you take a break, that you are doing your exercise snack, it's also important to relax those muscles. And instead of being the whole time in the computer or on your desk or tense like this, remember to do some exercise. And you can do a breathing exercise. And what I recommend is on your chair, just your arms relax around your body like this, and then you close your eyes, and then you just ground yourself on your breathing. So take a couple of deep breaths and relax here, and breathe out. Breathe in and breathe out. And when we're doing this, remember to relax your muscles and pay attention to the air coming into your lungs and out through your nose and your mouth. And you do this 10 times. You can also do some shoulder rotations to relax your shoulders. But there are so many different options for relaxation exercises. This is just one of them. Deep breathing, relaxation, and you can schedule. Maybe every hour you put a little reminder on your phone saying, remember to do the relaxation exercise, and you do this a couple of times. You will see that at the end of the day, you're not so tense and you're not so tight, and those trigger points are not hurting that much. So in summary, take breaks during your day and choose 5 to 10 of the exercises that I mentioned before. You don't need to do all of these 25 exercises at once. I usually take breaks every 2 hours, especially when I'm working in front of the computer. And then I do 5 of these exercises that I enjoy the most. It doesn't take more than 10 minutes. Remember, the exercise is snacks. Use the comments below to write your suggestions, ask questions, or suggest topics for future videos. If you go to the See More below of this video, there is a description of all of the products that I mentioned in this video if you're interested in purchasing them. I added some timestamps to this video so you can watch the parts that are useful to you, like the summary of these exercises. Also, if you go to the description of this video below, there is a link to a document that you can download, and it summarizes all of the content of this video, including the SSAR exercises. Please don't forget that this video is for educational purposes only. If you have a condition that needs medical advice, please talk to your doctor. If you have any question about exercises for you, please talk to your physiotherapist. I'm not able to provide you individual advice. And if there is an emergency, go to the nearest emergency department. If you like this video, give a thumbs up here, turn on the notifications, and don't forget to subscribe to this channel. If you turn on the notifications, you'll be alerted when I post new videos on this channel. There is a share button here too. You can send this video to your friends. I have many other videos on this channel. Check here for other topics that you may find useful. You can also find me on Twitter, Facebook, and Instagram. Thank you for watching. Goodbye.